I'm Abigail.
Our presentation is on pneumonia. Pneumonia is a lung infection that can be caused by a virus, bacteria, or fungus. The infection causes the alveoli in the lungs become inflamed, filled with fluid or pus. Signs and symptoms are headache, loss of appetite, increased heart rate, vomiting, nausea, clamminess, cough with sputum or phlegm, a fever, shortness of breath, and mood swings. The viral part of pneumonia for children, it can be caused after RSV, which is respiratory sinusitis virus, and in adults after influenza A or B. The current virus they have moves their way towards the lungs. It is serious with pregnant people and people with pre-existing heart and lung disease, and 30% case of pneumonia is caused by the virus. There is the most common part of pneumonia is bacterial, which is known as walking pneumonia, which most people don't know they have it. It affects 900,000 people yearly and is typically developed after the cold or the flu. It affects people with low immune systems, respiratory disease, and those who live or work in crowded areas because it is spread by sneezing and coughing. It is very contagious. And then the fungus pneumonia is typically called valley fever. It's caused by a fungus that lives in the soil in the southwest part of the U.S. Anyone who inhales the spores can become infected. Those at risk are 60 years or older. They have a weakened immune system or children. This type of pneumonia is not contagious. A few diagnostics and testing. The first would be to listen to any crackles or bubbling in the lungs. A white blood cell count would be to determine if there was elevated white blood cells, determining that infection was present. A chest x-ray. The chest x-ray will help determine the location of the infection in the lungs, and the pneumonia will show up white on the x-rays. And then there's also the sputum culture test, which the patient will take deep breaths and cough to get the sputum from the lungs. They will have to fill up a 5-millimeter cup with the sputum. The sputum will then be collected and looked under a microscope for the infection. And then you can also put the pauxometer on their finger. It'll be done to determine the amount of oxygen in the blood. And that's it.
So for treatments, pneumonia was always a big health concern in the community because it had such a high mortality rate before there was any treatments. The earliest treatment or one of the earliest treatments for pneumonia was anti-pneumococcal serum therapy, which is an anti-serum therapy. It did prove to lower mortality rates, but it was very time consuming and costly. So it wasn't effective overall. One of the first antibiotics used for pneumonia was sulfapyridine, which gained popularity after curing Winston Churchill's bacterial pneumonia in the early 1940s. But it was quickly replaced as the drug of choice for pneumonia by penicillin in the late 1940s when penicillin started gaining popularity. But at that time it was used for a lot of illnesses, so a lot of the pneumonia strains developed a penicillin resistance. So modern treatments for bacterial pneumonia at least are different antibiotics that can either be bacteriostatic or bactericidal. They're meant to help the immune system fight off the disease. Some of them are macrolide drugs, which examples would be azithromycin or clarithromycin, fluoroquinolones like ciprofloxacin and levofloxacin, and tetracyclines such as doxycycline and tetracycline. Also now, due to a lot of people being prescribed Z-Paks when they get a bacterial infection, there's a lot of pneumonia strains that are resistant to macrolide drugs. If a patient were to go to the hospital, they might be treated with IV antibiotics or given oxygen therapy. To treat viral pneumonia, there are several different antivirals that could be used, such as ribavirin, zanamivir, and acyclovir, and they can either be used for treatments or prophylaxis. And then also for fungal pneumonia, they can prescribe antifungals, and sometimes they'll have to go in and do surgical debridement to remove necrotic tissue from the lungs. And then also, there's symptomatic treatment. So a patient with pneumonia could take aspirin, NSAIDs, or acetaminophen to help control and lower their fever. They should drink plenty of fluids to thin the secretions in their lungs and help them to cough them up. Semen humidifiers can also help loosen secretions in the lungs to get out the infection from the lungs. Rest is recommended, and also cessation from smoking or making sure that you're not around anybody that smokes to help keep the lungs healthy. And prevention for pneumonia, there are two specific pneumonia vaccines. The first one is the pneumococcal polysaccharide vaccine. It was developed in 1977. It protects against 23 strains of pneumococcal pneumonia, and it should be used in immunocompromised adults or elderly people over 65. And it's also known as PPSV 23 or the Pneumovax 23. The problem with this vaccine is it couldn't be used in children under 2, so like immunocompromised children or babies would get pneumonia, and there was nothing really to stop them from getting pneumonia. So they developed the pneumococcal conjugate vaccine in the 2000s. It protects against 13 strains of pneumococcal vaccine, and it's specifically for use in children under 2 years old. And it is known as PCV 13 or Prevnar 13. And so the adults over 65 these days would receive both of the vaccines. They'd first receive the pneumococcal conjugate vaccine, and then a year later they would receive the pneumococcal polysaccharide vaccine. And that also goes for immunocompromised adults. It's important to note that these only protect against the pneumococcal bacteria that causes pneumonia, so patients will still be susceptible to Mycoplasma, Chlamydophila, and Legionella pneumonia. And then there's also indirect vaccines that can help protect the patient from viruses that may lead to pneumonia. These vaccines include the Hib vaccine, flu vaccine, Tdap or DTaP, and also the chickenpox vaccine. For prevention, also, it's the spread of the pneumonia bacteria, viruses, and funguses are easily prevented through good health habits, such as good hand hygiene. Patients should wash their hands with soap and water, warm water, for at least 20 seconds. Smoking cessation to keep the lungs healthy, and also just overall good health to maintain a healthy immune system. And then patients who already have pneumonia should practice good hand hygiene as well, and also proper sneezing and coughing techniques, such as coughing or sneezing into a tissue and throwing it away or into the nook of their elbow.
Some psychological issues. Patients usually have depression and mental and physical impairments. This can leave patients unable to perform basic living tasks, and the loss of independence can develop depression because they're relying on family members or caregivers.
After pneumonia, patients can have long-term effects that are similar to that of heart disease, such as loss of function and diminished quality of life, so they are losing their independence. Some educational resources, such as the CDC and the American Lung Association, provide information on pneumonia, And initiatives such as the Bill and Melinda Gates Foundation and Stop Pneumonia initiative can spread awareness, promote care, and generate funds for research on pneumonia. That's it.
And this was our resources.